Well, for some of you, the opinions on whether to gather or stay home may be different among your family members. Dr. Jessica BENITO with the Center for Healing and Recovery says we must first recognize that we have to prioritize what is important to us and then set healthy boundaries, both emotional and physical, and that can include saying no.
I don't really feel safe doing that. I would rather stay home and not putting on the added pressure that sometimes comes with the expectations of holidays. And one of the most important things to handle anxiety in general is being able to make a distinction, especially right now, is being able to make a distinction between what is in our control and what is not. And so many of the things that we are all facing right now are outside of our control.
Dr. BENITO was one of 3 guests who participated in a virtual town hall earlier today on our website, kshb.com. Topics included how to handle the physical, emotional, and economic effects of this pandemic. Our anchor, KNUTE, served as a moderator. So, Caitlin, what were some of the big takeaways from today?
Well, Kevin, I'd say one of the overall takeaways was with good news on the vaccine front, there's at least hope on the horizon. But medical experts stressed, first we need to buckle down during the holidays and do our part to limit the spread.
Despite warnings from health experts to stay home, people are packing airports and preparing to travel. So what's riskier, the trip or the destination?
I think that possibly the gathering itself. We have seen and heard of countless anecdotes of people who have gotten ill and really either not known where they did or just met up with a few friends who they thought were in their bubble. Unfortunately, you don't know necessarily who is in those people's bubble.
There are things you can do if you decide to chance it. The same things doctors have been telling you to do since the pandemic began. Wear a mask, social distance, and wash your hands. But is one of these more important than another?
There's indisputable evidence that masking works, but a lot of these studies are also done in conjunction with the other measures, and that's hand hygiene, and that is also with distancing. So they are both very important. But, you know, probably, I guess if you had to pin me down on one, I would certainly say masking is probably more important. But I would advise everybody to continue the distancing and the hand hygiene as well.
Still, health experts agree the only foolproof way to protect your loved ones is to stay home or quarantine for a full 14 days first. And if you're relying on a COVID test, you still need to quarantine and wait at least a week before taking that test. That way, if you've been exposed, there's enough viral load in your system for it to register.
And that's mainly based off the information that most of the people that will have symptoms within 5 to 7 days after exposure. I certainly would not get tested any shorter than 48 hours after the exposure, but really in that 1 week period, so 6 to 9 days.
We have much more on testing timelines and COVID protocols on our website. And if you would like to watch that town hall in its entirety, you can do so on your favorite streaming platform like Roku TV and on our KSHB Facebook page. Kevin?